Okay, well, we're headed into the home stretch. We've got 3 companies left. So the next one up, you may think after you see this that they're tackling what many have considered the holy grail of medical informatics, a decision support system that actually thinks like a physician. It's a goal that's eluded us for decades. But the time may very well be now, and I hope you'll welcome and see that in action with Grand Roundtable.
Thank you. Hi, everyone. I'm Eric King, founder and CEO of Grand Roundtable. July is the worst month to go to the hospital. Why? Hospital mortality rates spike. And it's not because of gang violence. It's actually because new residents are starting their training. That's because clinical experience is really at the heart of diagnosis and treatment. It's all about pattern matching. A doctor's ability to view your case and compare it to their past cases enables them to figure out what to do next. Young residents simply lack this repertoire of experiences to draw on yet. This is the entire reason that medical residencies last anywhere from 3 to 8 years in length. Doctors are building up their internal database of past cases to help them with future patients. But the solution right now is very inefficient. Doctors are learning through an apprenticeship, through lots of trial and error. All along the way, they're taking stabs in the dark, ordering medications and treatments and tests that may or may not work, where older doctors, more experienced ones, actually would not have ordered the same tests. Meanwhile, think about all the time that's spent by patients in the hospital waiting while younger doctors are ordering these tests. But beyond just inconvenience and frustration, this is an expensive problem. Patients spend 1 extra day, according to a study, patients spend 1 extra day at the hospital on average when inexperienced doctors are the ones treating them. This may not sound like much, but it turns out that each additional day costs a hospital $10,000 in revenues lost. So if you look at a medium-sized hospital with just Medicare patients alone, this costs a medium-sized hospital $20 million each year. Across the 2,500 medium-sized hospitals in the country, the problem of inexperience costs us $50 billion in lost revenues. And it gets worse. 1 in every 3 patients is considered to be medically complex, meaning that they have multiple comorbidities and medications that they're on. Just think about your older patient that you can't just that a doctor can't just look up in a book or a clinical guideline on what to do. There simply is a total lack of tools to address this problem. That's why emergency room doctors are actually referring to Google to figure out how to treat their patients. We can do better than this, and you as patients deserve better than this. I left med school midstream, motivated to help our future doctors have the right tools to manage medical complexity and practice more effectively. I taught myself how to code, and after boning up on my skills at another startup, I decided to take on this issue head on, to develop the next generation of clinical decision support. What better timing? Over the past several years, we are now at a point where 70% of patient records are now digitized in electronic health records. This means we have an opportunity to tap into the collective wisdom of thousands of doctors across millions of patients. A doctor doesn't need to just rely on trial and error to gain that experience anymore. We've developed a tool integrated into the electronic health record that pattern matches any single case against a database of millions. This way, a doctor can see what others did on a similar case and ended up concluding on their patients. The foundations of our solution are indexing all the information that's out there. We've indexed all of PubMed on a hard drive, but beyond just medical literature alone, we're also indexing millions of de-identified health records, as well as millions of health plan claims. In essence, our goal is to arm every 30-year-old doctor with the experiences of the 50-year-olds in the health system, who have already been there and done that, avoiding all these inefficiencies. But I also want to point out that our solution is important for the 50-year-old as well. That's because medical knowledge is just growing at an alarming rate. In fact, in the next 10 years, the amount of medical knowledge is actually going to double. Just think about that, double in size. It's no longer possible for a physician to just keep all of this medical information in their head. While a doctor can see thousands of patients over the course of a given year, the amount of disease states, different medications that patients are on, and combinations that can arise make it really unmanageable. But an older physician can use our tool to see what other doctors did with similar medically complex patients, and to keep up with what the best practices are on their own patients. Here's how our tool works. We are constantly in the background of the electronic health record, comparing a physician's current case to our database of millions of past patients. When we find good matches, the physician will know, because our button, which is a plugin in the electronic health record, changes color from yellow to green, letting the physician know that we have good matches for them. When they click on the button, we show them summary information about their case, and then most importantly, we provided them with similar cases. These similar cases are filtered by what other doctors ended up doing next and concluding about their patients when they were in a similar situation. If the doctor wants to see any single similar case on its own, all they have to do is click on one of the filters, and they're able to compare their case against the similar case, seeing what's similar and what's different, based on the concepts that we extracted in both. No doubt we've made significant progress throughout the DreamIt program, both commercially and technologically. But what I want to point out today, what I want to emphasize today, are our early adopters. We are thrilled to be starting a pilot in the coming weeks at Pennsylvania Hospital, where the chief medical officer is sponsoring the pilot, and over 50 residents will be using our tool to help in learning and decision-making. But I also want to point out that our technology is also useful for our back-end technology is also useful for other clinical purposes. We are at the cusp of entering Independence Blue Cross to sift through their medical claims data to identify diagnoses that may have been missed. Helping identify patients before they end up coming to the hospital with a diagnosis that they did not know about. None of this would have been possible had it not been for my fantastic team. Christy is a recent Wharton grad with significant healthcare, marketing, and analytics experience. John Schaefer is our brilliant data scientist who has developed our core technology from the ground up. And he's constantly refining it with a team of doctors. Finally, Hassan is a seasoned developer and our product manager who's designed, implemented, and ultimately delivered, and ultimately is responsible for delivering our product from end to end. Also, we have a fantastic group of mentors and advisors, without whose own wisdom has been critical in our continuing development and success. We are raising around $500,000 today, starting today, in order to continue building up our infrastructure to accommodate this growing need for us to process more and more data. We also will be refining our engine, and we also want to fuel our continuing development of our customer pipeline. If you share in our excitement for the next generation of clinical decision support, please come to our booth. We'd be delighted to get to know you. Thank you very much.